Olá, estamos hoje aqui no Hospital da Cruz Vermelha, recebendo a ilustre presença do Dr. Marco Bobbio. O Dr. Marco Bobbio é protagonista do movimento Slow Medicine na Itália e é autor do livro Doente Imaginado, um livro muito importante que foi lançado recentemente e que colabora muito e vai a sentido da segurança do paciente. Então eu gostaria aqui de agradecer a presença do Dr. Marco Bobbio.
Obrigado.
E dizer ao doutor que nos explane um pouco sobre a Slow Medicine e sobre o seu livro Doente Imaginado.
Obrigado. The slow medicine movement, started in Italy in 2011 because a group of physicians, health professionals, citizens and patients decided to get together because they were fed up of medicine that is driven by technology and medicine that has lost some values of the relationship between patients and the physician. So a group of health professionals, physicians, citizens and patients decided to found a movement whose manifesto was to fight for a medicine that is sóbria, respeitosa and justa. And so means that we want to have a medicine, to start again, to reuse the medicine that is close to the patient. Just before the foundation of the movement, I've written in Italian a book that has been recently translated into Portuguese called O Doente Imaginado. O Doente Imaginado is referred to a patient that is planned by the industry, by physicians and by the medical society to be worried and to buy a lot of drugs and to undergo a lot of tests. That's what the society need in order to maintain the business of the health system. That's why nowadays is increasing the army of the so-called worried wealth. So patients who feels well, who are healthy, but they are worried. And they are worried because we told them that they are at risk of a lot of disease. For example, at the conference this morning, I show an ad that was published in a journal, in a magazine, saying if you have a skin, you are at risk of melanoma. That's the way to make the citizen scared about their future, and so to induce the need for any sort of medical assistance.
Okay. Eu queria também perguntar para o Dr. Marco como funciona o movimento Choose Wisely, ou Escolha Sabiamente, né, em português, na Itália. Como acontece hoje esse movimento na Itália?
The Choosing Wisely movement started in the United States 5 years ago when it was asked to the scientific societies to identify 5 procedures at risk of inappropriateness. Well, in Italy, Slow Medicine decided to launch the same sort of project also in Italy. And since the expression choosing wisely in Italian is not so understandable, we changed the name, and in Italy the project is called Doing More Doesn't Need to Do Better. That's a very clear expression, because you explain that doing more doesn't need to do better, because sometimes doing more means doing worse. So in Italy we started with the same sort of projects. We asked the scientific societies to identify 5 procedures at risk. Nowadays 24 Italian scientific societies identified the procedures. And it's interesting to underline that 50% of the procedures chosen by the Italian societies are similar to the American one, and 50% are different. So means that the level of inappropriateness is different in different states.
Ok. Isso vai bastante de encontro, né, ao modelo que buscamos aqui no hospital, né, ao modelo que o hospital tem investido, né, para construir. E no seu hospital, né, na Itália, no hospital que o doutor coordena, quais são as medidas, né, que são tomadas a favor do escolher sabiamente, né, do choose wisely? Em seu hospital, como funciona? Quais são as medidas tomadas no seu hospital para essa finalidade, doutor?
In the hospital where I worked in Cuneo, that's a city in the northern western part of Italy, we decided to apply this principle of the Choosing Wisely project that was studied to be applied at a national level to the scientific society, to apply this project in a local experience. So we asked to the physicians of each department of the hospital to identify which are the procedures that they feel to prescribe in an appropriate way. And that after a work of several months of a sort of brainstorming, each of the 33 department of the hospital identified the 3 procedures at risk. And so we worked for 1 year to reduce the incidence of inappropriate procedures. And this program started in 2013. And this year we redo the analysis, so some department changed the procedures because there was not reliable. In some cases they obtained the results and so they needed to change, or sometimes they kept it the same. And so in this way the hospital became everyone in the hospital worked to do the procedure that in an appropriate way. That's the reason why at the beginning of October in Cuneo will be held the first national workshop of the slow hospital movement. Of the movement of slow hospitals, it's better to say, because in Italy, following the example of the hospital of Cuneo, several other hospitals and local departments started to identify inappropriate procedures. And so the first workshop will be held in Cuneo next month, and so we'll put together the experience of all Italian hospitals and we'll plan what to do in the future.
Ok. Bem, dos pontos do movimento da Slow Medicine na Itália é o movimento Buongiorno Io Sono, que é bastante interessante e vai numa linha, né, de aproximação do médico e do paciente. E essa é uma temática, uma busca do nosso hospital também. E eu gostaria que o Dr. Marco falasse um pouco sobre essa ideia.
Yes, thank you for the question, because it's a very interesting project. It started last year in the United Kingdom, where when a physician was affected by cancer, so a physician had to become a patient for a long period of time. And at that point, she felt that living in hospital, nobody introduced himself when coming to her bed. So she didn't know if the person coming to his bed was a doctor, a specialist, a generalist, a nurse, or whatever, or therapist, or whatever. So she launched a project called Hello, my name is, and then you can add your name. And so in England, a lot of people got some selfies with the child, hello, my name is. So Slow Medicine decided to launch the same sort of program in Italy, and of course we changed the name, and in Italy the program is Buongiorno, io sono. And now in our website we have already hundreds of pictures of people who have the note with Buongiorno io sono and his name, and so he learned that from now on, going at the bed of the patient or receiving a patient in an office, the best way to introduce any kind of relationship with the patient is to say Buongiorno, io sono il dottor Marco Bobbio.
Isso é muito bonito, porque por um lado a Slow Medicine protege o paciente, né, à medida que você usa menos tecnologia, né, a tecnologia justa para aquele caso, né, e por outro lado você humaniza a assistência. Né? Então isso é muito importante e vai no caminho da construção que nós queremos para os nossos hospitais, né, do Brasil e do mundo. Muito obrigado. Gostaríamos, né, de agradecer